Welcome back. Today we're going to talk a little bit about the temporal mandibular joint. This is associated with TMJ or TMD nowadays, temporal mandibular dysfunction. This is very common. We see this in our office all the time, but it's not something that most people think, hey, well, I need to go see a chiropractor about this. You might go see your dentist about it. You might talk to your doctor about it, but there's not a whole lot they can do other than give you maybe a night guard, which is helpful, by the way. But as far as what's going on dysfunctionally or structurally, not much, a lot of other people can do other than surgery, when I don't really suggest going and wiring anything right away, right? There are a couple of different things to look at when we're looking at the temporomandibular joint. Okay, you have a disc that's actually in there, and I actually over made that big just for simplicity's sake. It's a little bit more intricate than that, but it's tied to the pterygoid, which is a muscle, and then you have a couple ligaments that will actually pull and kind of keep that in check. Now, that should stay here, okay, and it should help it glide back and forth the way it's supposed to. Now, the joint itself in the jaw actually goes in 6 different directions, just like this. There's an X, Y, and Z axis that it does slide down, because you can open your mouth and you can actually slide the jaw side to side. And jet it forward and backwards. So you got all of the ranges of motion so that you can, get the food down. Unfortunately, there are a couple of problems. It can get stuck. Okay, this guy right here can actually slide backwards. So the cartilage disc can actually slide a little bit backwards, maybe not completely, but slightly down into the groove there, and that causes a whole lot of dysfunction and mayhem, if you would imagine. Also, the jaw can get stuck in a one position, say out to the left or right or whichever, and if it gets stuck, then that's also going to cause everything in here to not move properly, again causing a dysfunction. So my job will be to assess. We'll check the jaw, because it could be stuck on one side but causing pain on the other side. It could be stuck as you're opening your mouth, or stuck kind of closing your mouth and you're hearing grinding in there. So all of these things need to be assessed, which we do in our office, and then we adjust accordingly. And there's a couple different ways to adjust. We can either do it with our hands or with the tool. It's really what we decide to do with the patient, and it's all for patient comfort. So if you're scared, we still got some solution for you. Don't worry about that. Just come on in and see what we can do for you, right? But there are a couple of different things to consider. There's a couple of muscles that come up here, called the masseter and temporalis. They actually make the jaw go up and down. Obviously, if you're chewing a whole lot, that's usually that muscle that's hurting a lot after you've chewed about 10 pieces of pizza. Not saying to do that, but I'm saying once you've chewed so much that your jaw hurts, that's usually that muscle that's really not happy with you. Okay, those muscles can also be involved. So there's a couple of muscle releases that we sometimes do with doing our treatment, and so we'll do that. We'll adjust in there as well, get that range of motion back into the jaw. Usually most patients feel relief within the first couple of visits. So it's actually a very forgiving joint, although it does tend to go back out from time to time. So just come on in, let's get you assessed, and if you know anybody, send them our way. All right.